Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
I know there's some fast food restaurants that advertise, flame grilled hamburgers, burgers,
Yeah,
cheeseburgers, things
yeah,
like that. Mm.
yeah. Well, of course, the processed meats is another story, but yeah, yeah. It's amazing the things that we advertise that are lethal in many ways. Yeah. So, okay, I guess we can start the articles now. I just wanted to call your attention to some of those things. This is a kind of frightening articles in the sense that as we have a Secretary of Health that has not been so much in love with vaccinations. And since we have a kind of a sudden reappearance of measles, which was in 2000 eliminated completely from the United States, now it's resurfacing itself. And uh, this article talks about the fact that it can become endemic again in 5 years if we aren't careful about insisting on the need for vaccinations and how that we've had some articles that identify over 1,000 cases of measles, which had been totally eliminated, and how this could, uh, if we don't increase rather than decrease the vaccination rate, could result in measles coming endemic again. Talking again about how contagious measles is and how it's lethal to children and also problematic to people at all ages. And because of its highly contagious nature, it's more infectious than almost any other virus. So this is an interesting article that reminds us that we've come a long way because of vaccinations, and we don't want to go back to where we were. So many people are alive today because of the protective aspects of vaccinations. So we have to keep that in mind. Any other comments? I know that this is a subject of discussion on the part of the Secretary of Health and others who do not feel that vaccinations should be mandatory.
Dr. Callender, yesterday I heard on the news that our Secretary of Health said he didn't really think that people would pay attention to him since he wasn't in the medical field. So that was him giving something about the vaccination and an excuse for he just didn't think people would listen to him.
Uh, well, that's an interesting. He said he wouldn't think people would listen to him. Now he's the Secretary of Health, so that says a lot for our country. Yeah. Okay, if there are no other comments, we'll go to the next article. Unless there's any, because this is a very potent question because most of the physicians in the last 50 years have not seen a case of measles, so they wouldn't even know how to identify it, not not to speak of treating it. So this is a subject for us to keep in mind that vaccinations prevent diseases which kill people. There are no other comments. I guess we'll go to the next article. This is particularly perplexing issue that the rates of obesity, high blood pressure, and diabetes keep climbing in spite of the fact that we share all the information about all of it. People continue to be obese. People continue to not take their blood pressure medicines. They don't monitor their blood pressure, and they don't control their diabetes. And what this says is that not that we don't know better, but that we aren't doing better. It's important not just to make a diagnosis, hypertension, diabetes, and obesity, but to do something about it, to see that they're properly monitored and controlled. Otherwise, what is happening is that while we talk about it, the rate of death from all of these diseases continues to rise. And that's something that we can do something about it. So uh, it's interesting that we also have talked about the alcohol, but we have not done much about it, even though all of those things are related to increased disease. Any comments? At least we've done something about cigarette smoking, but we haven't done much about the others. Darryl?
Yeah, well, of course, all three things are very directly related to each other: obesity, blood pressure, and diabetes. And, I think that what makes us so much different from the rest of the world is our intake of processed food that's contributing to all three factors.
Thank you for sharing. Any other comments?
Dr. Callender, enjoyed your talk yesterday.
Thank you.
I've been talking to a couple of people, friends of mine, and I told them it's according to the chart that I'm overweight. And their first comment was that that's the white man's chart, not, it doesn't apply to Black people. And then I was wondering if we could start somehow campaigning and just publicizing or just saying this is a Black man's chart. If you weigh this so much and you're this height, you're overweight, and then this is obese. Because most people, and I've seen a lot of women, and they really are obese, but they don't ever think the society just say, "Oh, I'm just a little bit overweight." So you think if we created a chart and saying this is whether you're big boned or small boned, they all give an excuse. And I have some friends and they know they're extremely overweight, but they'll say extremely overweight rather than use that word that is not politically correct. No one wants to say they're obese.
Well, whether they want to say it or not, there's no such thing as uh, a chart for black, white, green, purple. It's just a chart for people who are actually have their BMI that is over a certain uh, weight. If your BMI is greater than 30, whether you're black, white, green, or purple, then you're considered obese. If you're between 25 and 30, you're overweight. And that's not like the GFR where it was uh, altered for black people. BMI is irrespective of ethnicity. John Buchanan.
Yes, I hate to go back to the previous article, but the the definition of endemic as compared to pandemic.
Yeah, okay. Pandemic is worldwide. Endemic is in the area that you're speaking of. So that if it was only in the United States, it would be endemic. If it was across the globe, it would be pandemic.
So what do we think that this outbreak of this uh, infection now is going to be endemic, or I mean pandemic? Has it spread outside of the United States?
No, because I think most of the rest of the world is going to be vaccinated. So we're talking about it being located in the United States and
Okay.
therefore calling it an endemic.
All right. Thank you.
Darryl?
Yeah, we got a new thing. Well, yeah, relatively. It's called body positivity. and that's people being proud of whatever size they are, and they don't want criticism if they're obese, because then they say you're a hater, because you should be proud of being obese. It's really going the wrong direction.
My
Yeah,
question,
yeah, we see that on television all the time because most of the people now that you see that they're using are overweight, uh, proudly. And it's just like a lot of the truths that are lies that we say them so much we think the lies are the truth and the truths are the lies, and so we popularize the idea that it's okay to be overweight when in point of fact it is not.
what about the term morbidly obese? How do we handle that term?
Which term?
Morbidly obese.
Oh, that's a medical term. If you are more than uh, 50 pounds more than what is obese, they call that morbid obesity. So that's morbidly obese. That's a medical term for people who exceeded the normal uh, level of obesity and they've gone 50 to 100 pounds more than that. That's morbidly obese.
Carol has a friend that's morbidly obese.
We probably all have friends who are morbidly obese. John Buchanan?
Yes, I noticed a couple things Darryl mentioned, haters. Um, back in high school, it used to be really a proud thing to be in the honor society. And more recently though, the average kids would put down the smart kids, and to the point where they wouldn't even want to come up and get an award. Well, the same thing is happening to fat people in the music industry. Heavy D, all these rappers are real big fat fat people, and they're making a lot of money, being fat and talking about it. Yeah, fats. I'm fat and I'm okay. I'm proud to be fat. So I think that may be something to look at.
Yeah, I know
Yeah, I
one.
think, yeah, I agree with you. That's something that is kind of toxic in many ways, but because it's taking us in the wrong direction. But that's as I was saying, we're in a society now where truth is the lie and the lie is the truth, and so we get things so mixed up that wrong is right and right is wrong, and when in point of fact they are absolutes. Betty?
Yes. Good morning, everyone. Um, Piggybacking on what John Buchanan just said, yeah, they do talk about being fat, but once they get popular, they go on a diet and lose all that weight because
Some do, some don't.
it really has several of them have lost have have toned it down
Right.
and they
Yeah, some have and
realize,
some
yeah,
haven't. Yeah. Because
Yeah,
you see,
I know who John's talking about. There's a rapper by the name of Biggie. Well, his name used to be Biggie. Anyway, yeah, Biggie Smalls.
He's smart.
Darryl,
Yeah, there's this white girl, pop singer named Megan Trainor, and she came out with a song called "All About That Bass," and she was a big girl, and it was celebrating. There's a lyric in the song that says, "I ain't no size two, but I can shake it like I want to," and so she lost weight and changed the words to the lyrics. Instead of "I ain't no size two," she says, "I got new boobs." And the haters just came, they just ate her up. They said, "You're not proud of being a big girl anymore. You lost that weight, so you're not one of us. And we hate you."
the world we live in. Amazing. Any other comments? Okay. So, Carol, you had a comment.
Yes, our clothing industry and et cetera, they're making beautiful clothes now for women, large women, and then they got big and tall men to make clothes to fit so they'll look appropriate. And I went to my grandson's spring band concert, and they had the marching band. And it used to be the girls that were in the marching band were all small and petite. Well, they had one group that was small and petite and one group that had the little grass skirts on. They were sort of large. And it used to be, even like for cheerleaders, they were all the small petite
Yeah,
girls.
yeah,
And
yeah.
now, so since they don't discriminate, they're big, you know, and it doesn't even matter anymore because they can't discriminate and say only the small and petite people are like that. Like our airline stewardess, they were all used to be cute,
Yeah,
women. Now
yeah.
they got men, women, old, young, because they discriminate against old people. So I got on the plane once and saw this older woman who was definitely older, and I was saying, "Wow, have we changed in our society?"
So true, so true. Any other comments? Okay, let's go to the next article then. This is an article that talks about the earlier you make the diagnosis of high blood pressure and treat it, the better off you are. And this study identifies those people who have an early diagnosis of high blood pressure and are treated, and those that aren't. And of course, the biggest thing in this whole study of hypertension and the treatment of hypertension is not only the fact that you need to take your medication, but that you need to monitor your blood pressure. One of the things I meant to ask the group but didn't was how many people in the audience actually have monitors or blood pressure apparatuses at home that allow them to monitor their blood pressure. Because if you have high blood pressure and you're taking your medications and you don't know whether your blood pressure is up or not, then that's a problem as well. So not only having high blood pressure, which is very common among us, but knowing how to measure and monitor your blood pressure on a weekly and monthly basis becomes very important. And a good measure of whether or not you're appropriately managing your high blood pressure is whether or not you have a blood pressure apparatus at home that you can measure it. Of course, there are opportunities for you to measure at other locations in the CVSs and other places, but it's ideal for you to have a blood pressure apparatus that so that you can take your pressure at home. Buchanan?
Yes, Dr. Callender, how accurate are those sphygmomanometers that you get at the CVS?
Oh, I don't know anybody who's tested those monitors at CVS. I know they've monitored the sphygmomanometers that you purchase at CVS. Now, you're talking about the ones that you purchase or the ones that you just go and use at the drugstore?
The ones that you purchase and take home.
Oh, they are monitored so that but of course, if you have any questions about it, take it to your doctor and have them check it for you so they can monitor it.
Okay, sounds good. Thanks.
Carol?
Okay, I was wondering, you see advertisements everywhere that the medical field is just taking our money for these blood pressures. There's way to get, I mean, high blood pressure. There's ways to either eat or you take this particular drug or something, do something for a period of time, and you'll get rid of your high blood pressure. Is there any validity to all of these advertisements that they're doing now? And they say, look, I did this for so many days and my blood pressure is under control. I do not have hypertension anymore.
Well, you see, the real answer to that question is how long have you monitored your blood pressure? Because far too frequently, people who have had their blood pressure monitored and corrected, they stop their medications or they stop monitoring their blood pressure, and then it goes out of whack. Then they wind up having hypertension and kidney disease. And so it's important to monitor to make sure that it stays normal. And the normal that we're talking about is 120 over 80 or less. And so if you're monitoring that, and even after you take your medication and stop taking your medication, if you're still monitoring it, then it's safe to say that your blood pressure is controlled. But if you're not monitoring it and not checking it to see, then it's not a good idea, because many of those people get off the medications and forget about it, and the blood pressure problem recurs. Darryl, and then Lucy Perez.
Yeah, a great idea about taking your home monitoring kit to your doctor's office for your regular physical to make sure that it's reading correctly. And then the other thing is, if you do monitor your blood pressure as you should daily, in the morning and evening, if you have high blood pressure, then make sure that you change the batteries, because you can get false readings once your batteries get weak. So, it's probably a
Good
good idea
point.
to change the batteries monthly.
Very good point. Very good point. Lucy Perez.
I guess that was pretty much my comment, that you make sure that your readings are the same as you get in the medical office, and that you don't get the machines that monitor your blood pressure with your wrist or your finger. It should be coming from your arm.
Earl Liscombe.
And my comment was about the last article we discussed about being obese or overweight, whatever. And I was wondering whether your genes or whatever has anything to do with that. Because, as most of you know, Betty and I are sisters, and she's always been small. And I've always been large. I've always been larger than any of my sisters and brothers. And we've all grew up in the same household, eating the same foods, doing the same thing. So I was just wondering whether genetics or, had anything to do with
I think
you.
genetics has everything to do with it. And I think what we haven't learned is that epigenetics, as Darryl had spoken about last week, is the lifestyle that you adopt may modify your genetic predisposition. So yes, it does have something to do with it, but your lifestyle and your nutrition and other things, exercise, etc., meditation, etc., will address the genetic predisposition and can overcome that genetic predisposition. Uh, uh, Joyce, and then Elizabeth.
Good morning, everyone, and thank you, Dr. Callender. I've seen advertisements on the television for where there's an app that you can put on your phone that you can monitor, or you can take your blood pressure with your finger. And I was wondering, is there anything that can validate the accuracy of that?
I'm not aware of anything that validates the accuracy of that. So if there's anybody on the session here that has seen a study that validates that, they can comment, but I have not seen any data that validates that.
Yeah, I just raised my hand
Elizabeth?
to address that. Okay, what
Okay,
the
Darryl.
internet says, can phone apps really measure blood pressure? And it says current smartphone sensors are unable to capture this level of detail because they lack direct access to arterial blood flow and pressure. So no, they don't do a good job of measuring blood pressure, but they want to sell you the app.
Thank you, Darryl. Elizabeth?
Yes, good morning, everyone. Good morning, Dr. Calder. Thank you for coming. It was excellent. And I told the people if they want more of this wonderful tight presentation and actually to join us today. My comment is,
Thank you.
and thank you so much for coming. My comment quickly is, I was given a blood pressure machine by my doctor, which is tied into Kaiser, where my reading goes directly to my doctor. And I've had, but prior to that, I've had two machines that I purchased myself. But because my records did not agree with her records, we came up with a solution of my blood pressure going directly directly to the doctor. And it has a little notes where I put my notes and my comments in it to help guide me. Now, this has helped me a great deal because it helps me with my nutrition, with my exercise, and my 10 pillars of wellness. So this has been a great advantage because the environment and the surrounding and the whole my well-being is different from the doctor's office. And I'm not going to comment on that, but it's just a more relaxed situation with me at home. And it has been a great advantage for me.
Thank you for sharing. I appreciate the document you had at the meeting, which is very excellent, and hope people would read it because it has many pearls in it. Betty Blaylock.
Yes, two comments. First, I'm gonna piggyback on what my sister said about genetics. Um, we we do have same parents and all, but we had one parent. My father was big, my mom was small. So I don't know whether that has anything to do with it either. But the second comment is about what Elizabeth just said. My doctor too gave me a machine to monitor that would go right back to, to the office and whatever. But it malfunctioned. So, it's kind of hard to, it wouldn't read right and it didn't do it. Finally, it wasn't.
Well, one thing is clear is that the pressure you take at your house is superior to that you take in the doctor's office. And so it's important for you to measure your blood pressure at home and and what you can do is write down those readings and share it with your doctor so that they have an idea. Of course, if you have it so that it goes directly to the doctor, that's fine. But if not, you can just write it down and share those readings with them. Darryl and then John Tatum.
There's an old expression called whistling past the graveyard, and that's when you pass the graveyard and you try to pretend that it's not there and that you'll never be a resident of the graveyard. And it's kind of like that with hypertension. People don't realize what their life would be like if they had a stroke. I had an old boss that does a Facebook journal now daily on her recovery from a stroke that she had in December, and it's really eye opening. She goes in pretty good detail, but if you really thought about what your life would be like if you had a stroke, you would do everything you could to manage your blood pressure.
Thank you. Thank you for sharing that. That's a wonderful point. Wonderful point. John Tatum.
Yeah, we've talked about on this group session, we've talked about the anxiety that you experience when you have your blood taken at your doctor's office, as opposed to what Elizabeth said at your house when you're relaxed, and what I think we said, maybe I could be wrong, but we said that when you have your blood pressure checked at your doctor's office, there could be some anxiety that affects the reading.
Yes, that's called white coat hypertension. And that's why the ideal pressure is, as you and Elizabeth have identified, is the pressure you take at home. And the other one is a suspect because of the other circumstances that you mentioned. Thank you for sharing. Any other comments? Betty, your hand's up again.
I thought I heard Dr. Perez say the best cuff would be on the arm as opposed to on the wrist. Is the
That's
reading,
correct. That's what she said.
is the reading that much different? Or
Well, Dr. Perez, did you want to make a comment about that?
In terms of the reading, I think that so often we miss it. And the machines, I know I've gotten them from both, we're not shopping at Target, but in many of the other places. And I've had a good similarity between what was taken in the doctor's office and what reading I got personally. But many of my friends have, for convenience, gotten machines that take their blood pressure either from their fingers or their wrists. And that is really not a good indication of an adequate blood pressure. So, whatever machine you have, it should be in some way, shape, some type of way coordinated with what's happening in your medical office. Does that address the question?
That answers the question, yes. Joyce next, and then Sylvia.
One quick question. I don't know if I read this, if I heard it, or if I saw it on TV, but or even if I dreamed it. But a discussion on in the mornings when you take your blood pressure, you normally don't eat prior to taking your blood pressure, or I know I do not. But drinking a glass of water to stimulate your blood in your body or just stimulate movement in your body can help with your blood pressure readings that you get. And I want to know if that's true. I did put it to a test, and I have found that if I do drink something right before taking my blood pressure, or maybe an hour before taking my blood pressure, and then I took it and took my blood pressure without taking it, it did make a little difference. And I just want to know if that's truly, um, um, is that a true symptom that can affect your blood pressure?
I'm not aware of any study that has identified that as a
Okay.
factor. Anybody online that wants to make a response to that? But I'm not aware of any study that has identified the connection between whether you take a drink of water or not.
I
Okay.
know some nurses have told me that that's a technique that they use to quiet, as you said, white coat hypertension. That they're little tricks that some office practitioners um, use to kind of calm you down so that you take a better reading of your blood pressure. So stopping, pausing, and drinking a glass of water is relaxing you.
Mm.
Some may say a prayer, count to 20. There are many strategies that could be used in a particular office. And the point of the strategy is to relax you so that you get a better accurate reading, not the fact that drinking the water is lowering your blood pressure.
Thank you very much. And that makes sense. Thank you.
Sylvia?
Yes, good morning, everybody. I was driving. I was dying to get to this parking spot so I can make this comment here. My mom, who's been with me since she's been out the hospital, is, going through physical therapy and has a nurse and the physical therapist coming. And we have different readings on the blood pressure machine. And what he told me to do, he says, I want you to put the cup on your arm. And I took a reading, and it was like maybe I'll say 157. He said over, I can't remember what it was over, but he says, now let's cut it off. And I want you to take a deep breath, breathe in and breathe out. wait a second or two. Now I want you to take it again. And it was like 20 points lower. So that breathing and relaxation, I think, really does make a difference in how the measure. He said sometimes these machines, and our machine was calibrated at Charles's doctor's office, but to get the different readings from the machines and like this physical therapist and the nurse, they used the stethoscope, whereas we had the one where you put on your arm and it'll just inflate. But I'm get confused with these different readings that the machines actually give. But he says you can take it a couple of times, but just relax. And I do make notes for my mom, like before breakfast or before medicine, and then we wait an hour and a half after medicine, and we get such different readings. So I was just concerned with how the medication is really impacting on her body. And then I was concerned also with how the different readings come as you wind down and you try to relax. So I think it's important that you do try to just brace yourself and breathe in and breathe out, and then take your blood pressure. Take your blood pressure.
Well, and it's a good idea that you need to take about 15 minutes between the time that you think you will need to take your blood pressure and the time you take your blood pressure to allow you to relax and do those kinds of things, which is why white coat hypertension has its term, because in the doctor's office they may not give you time to relax and sit and recover. Darryl, you're next.
Eating and drinking can have a temporary effect on blood pressure. Generally, after eating, that has more of an effect. And it's just a temporary slight effect. It can lower your blood pressure by 2 or 3, maybe 4 points. Um, but, it's kind of a way of fooling yourself. And so you take your blood pressure before you eat or an hour and a half after you eat. Um, as far as caffeine, coffee can raise your blood pressure. Excessive drinking, heavy drinking can increase risks of hypertension, and it also interferes with blood pressure medications. So that's my
Right.
contribution.
And I think one of the best advices is give yourself about 10 or 15 minutes a piece, and then get your blood pressure taken. Okay. John Tatum has a comment.
Yeah, Dr. Callender, what about taking your blood pressure medicine? Some blood pressure medicine is active for 24 hours and some less time than that. I've gone to the doctor's office when my blood pressure was a little high, and he would ask me, "Have you taken your blood pressure medicine yet?" I said, "No, haven't taken it yet." And so he said, "Well, go ahead and take it." And then you check it again and it's down. So that's a short-term effect blood pressure medicine as opposed to the 24-hour effect. Is that fair to say?
Well, you have different medications that last different periods of time. So it all depends on what kind of medication your doctor's giving you. Some medication lasts for 6 hours, some 8 hours, and some 24 hours. So it varies. And some act quickly and some take a longer time to act. So it varies on what your doctor is giving you. And it's important to know what type of medication the doctor's giving you so that you can monitor your blood pressure accordingly. The key, though, is to take it around the same time and to relax before you take it, and then record it so that it's something that you have that you can write it down, or if you have a machine that records it, then record it so that you can share it with your doctor.
Thank you.
Thank you for all of the questions about hypertension, because the real issue is actually taking your blood pressure, monitoring it, and trying to ensure that your blood pressure is controlled most of the time, so that you don't get the stroke, as Darryl has pointed out, that that complication is something that should be avoided at all costs. The next article then. Well, this included just to let you know that we're making progress. And we actually have an automated insulin system with a 1-year sensor. Of course, as you read the article, you realize that there are changes that have to be dealt with every 3 weeks or so. And there are other things that go into it. But the automated insulin system is with us. And nowadays, if you don't have an automated insulin system, you need to have one because that's the state of the art today. Some people don't need it because they easily control blood sugars. But for some people who have difficulty, the automated insulin system is a savior. Any comments about it for those diabetics who have their diabetes under control? Because just as with blood pressure, the issue is not whether you've got hypertension or not, but whether you have it controlled. The same thing with the diabetes. Is your blood sugar under control? Is your hemoglobin A1C in the vicinity of 6 or 7, or is the blood sugar 100 or less? So the monitoring of it is the real issue with hypertension and with diabetes and with obesity. Any comments or questions about the fact that we are becoming more and more automated with everything these days? Okay, if there are no questions, I know we have diabetics out there, so if there are no questions, we'll move on. But I think it's important to recognize that monitoring your blood sugars is as important as monitoring your blood pressures. Betty Blaylock.
Yes. I'm gonna do a John Buchanan and ask about the price of this because
Well, this is not even available yet. So
that's
while it has been FDA approved, they didn't have any cost identified with these.
okay. Okay.
But it's so early that I wouldn't recommend doing this until it's actually been used by many people, and because if you read the article, it talks about the changes that have to be dealt with every 3 weeks or so. So I wouldn't. It's just good to know that it's automated and it's available, but it's not really at the point where you need to use it right away. We already have automated systems that they don't last a year, but they do last a significant period of time. But that's not the one that I would deal with right now. I'd wait for it to be fully tested and used by many before I would think about using that right now.
Okay.
But I don't know the cost of it. That's the real answer. Lucy, Dr. Perez.
I think it speaks to how very, very important it is that we be part of clinical trials. Because as we gather information, if we are not part of the group that the information is captured on, then the information doesn't work well for us. And so it's important. I heard WPFW earlier this morning, so that means I'm back on the East Coast. Hallelujah! That AI generated by Elon Musk has incorporated into the intelligence that white Afrikaners, imperialists, are refugees in South Africa. So if you were to ask that AI a question, it would come across with that bias. So as we move forward, when there's opportunity for us to be part of clinical trials, and the work that Dr. Callender has done for equity and truth, it's important that we become participants in those clinical trials.
Thank you very much. The more we're involved, the better off we are. Any other comments? If not, we go on to what's your go-to treatment for new diabetic patients? Interesting that it's a good article because it talks about the fact that metformin is the kind of the treatment of choice. And of course, with the GLP-1 drugs changing everything, how many people now are on metformin or how many are on the GLP-1 drugs? And when will it be that you will switch over to the GLP-1s, or will metformin remain a treatment of choice for diabetes? I think we're in an era in which many things are changing because one of the things that metformin does is handles your diabetes. One of the things that the GLP-1 drugs, they're not only handling the diabetes, but they also protect your kidneys and your liver and other things. So down the road, things may change, but right now, it's important to recognize that metformin still remains the first line treatment until we've gotten more experience with the GLP-1 drugs. Any comment about this? Some of you are diabetics and some still on metformin and other things, and probably not thinking of changing because everything is going well, nor should you. But anyway, over the next 5 years, things may change dramatically because of what we find out about the GLP-1 drugs, positively or negatively. Cost is still a factor, as we mentioned last week, that it still costs about, if you don't have coverage, about $500 a month. Betty Blaylock.
Closer. Yes, yes, I was communicating with my husband who is a diabetic. But he doesn't take insulin. He's just on the pills. But his
Yeah.
doctor, maybe about a year or so ago, he heard about Jardiance, and his doctors switched him off of metformin and put him on Jardiance. Well, he asked for it. He said he asked for it, and she switched him to off of metformin and put him on Jardiance. But
Okay.
price was significantly different. And now she's switched him to Javernia or something like that, off of Jardiance to something else. But they again, the price is significant. So he doesn't even take he wasn't even taking the insulin, but they switched him from metformin. So I don't know
Okay.
whether that's
All right.
significant or not, but
Thank you for sharing. Thank you for sharing. Any other comments about management of diabetes? Okay. We'll go to the next article. This is something that is going to become more and more of an issue, and that is limited access to cardioprotective type 2 diabetic medications for the Medicaid population. As the new administration limits Medicaid and Medicare and other things, will you have the same access to the GLP drugs and other drugs that are mentioned, the SGLT2 inhibitors that are more cardioprotective than the other medications if you're a Medicaid person? And so time will tell. Some of the evidence suggests that uh, you will have limited access to some of the newer drugs. But time will tell, as a consequence of interaction with the Congress of the United States, with the House and Senate, you may be able to overcome some of these drastic changes that the new administration is planning for us and for our future. But one of the concerns is that they will limit access to the more the newer drugs, which may be more effective. As the SGLT2 inhibitors protect the kidneys, and GLP-1 drugs affect many organs. So, what will happen, and how can we impact our congressmen so that we do not eliminate Medicaid or decrease Medicaid's ability to cover medications that are the best drugs, is a question that remains to be seen. Any comments or thoughts about this as what happens with Medicaid and Medicare is going to affect all of us, I think, in the long run. And of course, they're talking about eliminating Social Security as well. So these are issues that if we're silent about, we may have loss of significant ways to survive. Any comments or questions about what the new administration is going to do with the Medicare and Medicaid and Social Security in the future? There are no questions or concerns. There should be.
To the people, this is ridiculous. Absolutely ridiculous. And the power of the purse is in the hands of Congress. It's ridiculous. You don't just roll over what did Job's wife said, curse God and die. No, that's not happening. That's not happening.
So what is happening?
What is happening is that we act as if we have no power. That we have to accept things the way they are. That wasn't the posture of Harriet Tubman. That was not the posture of Sojourner Truth. That was not the posture of Clive Callender. No, the only medical organization that stood up in defense and said we have to have not only Medicare, but Medicaid was the National Medical Association. This is not gonna happen.
Well, one of the things is that many of the medical organizations are together in protesting. The question is, what will be the power of their protestations? The one thing that we can overlook is that the president is a result of the majority of the people in the United States putting him there, and he's allegedly trying to accomplish what they put him in the office for. And if he's doing contrary to this, then it's up to us to let it be known that that's not acceptable. And we had a presentation by Wayne Frederick and others to make it clear that we need to make our protestations heard. We think one of the things that the church has been doing recently is speaking out. And I think this is just the beginning of what we need to do with the Congress of the United States, and also to let them know that this is not acceptable. Dr. Perez's protestations are great, but they need to be mirrored by most of us in the United States. Carol?
What is the best form that I personally can take, or all of us? Is it writing to our congressman or calling them on their phone? Or
Both.
So that means I got to write a letter and then I got to call them
Both.
on
Do
the phone.
both.
Do both.
Yeah, do both.
How
Yeah.
many people on this line I haven't done anything besides just gripe. Anybody else has done this personally on this line?
All the time. They're sick of hearing from me. And
Oh.
part of it is discussing it when you're online in the supermarket. There are a lot of people who believe, it's just getting out that people who were in many people who were in nursing homes receiving many of those services are people who are on Medicaid, Medicare, and Medicaid. And many white people, especially, think that Medicaid is only for Black people or welfare mothers, having 20 kids, but it was a slap in the face. When does the president tell you that your baby should only have one or two dolls? But he wants to get a gift from what is it, Qatar, a plane that's going to cost your tax dollars. These are our tax dollars, the purse. He is tripping around in Saudi Arabia and Arab countries right now on your tax dollars. Those eggs that you bought that have a tax on them, that is allowing your president to travel around and cut deals so that his children get $1 billion as pocket money, pocket change. They're building up their wealth for them and for their children on your tax dollars. Tell your congressman no. We are engaged in genocide. In Gaza, we have children who are dying because Israel refuses to let humanitarian aid in. Are you kidding me? My tax dollars? No. Don't go to genocide. If you want to be elected, if you want my vote, you say no. Talk about it when you're online. Let white people hear what the truth is because they're listening to lies, disinformation. We just let close to 100 Afrikaners come into the United States as immigrants with full rights and privileges while we're sending people who have been paying taxes here to El Salvador into jails. No, talk about it. Be angry about it. Say, no, this isn't happening. When we have our family reunions, that needs to be the topic. Not only what are our genetic diseases, but we cannot allow our tax dollars to enslave other people who look like us.
Darryl?
Carol wanted to know the most effective way of making political change. Yes, you can write and call your elected representatives, but historically, and this is around the world, there's a thing called the 3.5% rule. And that talks about nonviolent protests are twice as likely to succeed as armed conflicts, and those engaging a threshold of 3.5% of the population have never failed to bring about a change. This is worldwide. You have there are ongoing political protests in every major city in America right now. If you attend, bring your family, your friends, make sure they attend the protests, you'll get the change you want. They say that we're a divided country and 50-50 left and right, and it's hard to make that change. 50-50 are big numbers. But that 3.5% is a lot smaller number. You get involved in protests, and it never fails to make a change.
Thank you for sharing. Any other comments? as we face this crisis?
Yes, Dr. Callender. I'd like to piggyback on what Dr. Perez says. Just add a comment. The two groups of people that are being brought in, one of the service they receive is full SSI. And also I noticed that when I was in the BOA bank, they were giving away 17,500 grants in housing.
Okay, any other comments? If not, thank you for your response.
Just one more. I was more prone when I was younger, of course, in my 20s, late teens, of actually protesting and protests, demonstrations and etc. And that did cause a change. So I'm being bombarded right now. If you give to this cause, it'll help overpower Trump. And I figure he got more money than I do, but it's just that, you tried so many things. I got out and voted. I did this and then I protested. And I'll go back to being active again. But, I hear people, a lot of rhetoric, they're talking to each other and doing nothing actively. And that's what I was attributing to actually do something besides just holler a lot. I call that the think tank effect. We have a lot of think tanks of what should be done, but doing actually nothing. So I'm listening, and from whether I'm gathering the protests, I do see people protesting on the streets, and it is affecting Congress one way or another. And they're saying the congressmen particularly want our votes, and too many people, they're their voters and they're listening to the ones that are protesting.
Well, our church is sending a letter with signatures to the Congress to uh, try to vote no on some of these changes that are coming about. And I think many of the churches might act similarly to motivate Congress to make changes. And then, of course, the comments that Darryl shared were very appropriate. Dr. Perez?
There were 23 people who were arrested yesterday in wheelchairs. In wheelchairs. Because they said they stood up and said no. No. I think it's time for white folks to get out there. We're always out there. But I mean, when the disabled, the challenged community is saying no. When I walk in the Giant, they don't say, Lucy, everybody else is paying 5%, but because you're Black and we don't treat you right, you only have to pay 2%. No. No.
Okay, Betty Blaylock, you're next.
I did have my hand up, but I think everything is really being said that we really do need to do something. But I am glad to know that some of the people in authority, the judges and the kind of counteracting some of the things that he's trying to do, and they're pushing back on him. So maybe that will do some good. But I agree that we do need to speak up, and I have to say I'm one of the ones that have not been. So I can at least write. I don't mind typing a letter and sending it off. So I can at least do that. I'm not going to say I'm going to get out there and protest, but I can at least do that.
Amen. Amen. Everybody can do something. That's what the Black Panthers said. For the breakfast program, everybody, these are our children. These are our babies.
Um,
Everybody can do something. Pray changes things. And make sure that we pray. Where your choir rehearsals, where everything, bring it up. May it be the discussion. We can't give up what we've done. Anyway, we and we can make it so. We raise the bar. People won't come around us, won't talk about things that are unimportant. Like, well, you know what the bachelorette is gonna do when they're cutting Social Security, they're cutting Medicaid and Medicare. We can elevate the conversation for everybody. You are an entertainer. If you're not entertaining on the political level that is important for 2025, then I'm not buying your beats.
Okay. Darryl, and then Darryl again.
I'm saying, I hope that we don't believe that all Black people are against Trump. I'm coming across too many relatives, too many friends that have friends and relatives that are for Trump. When we believe that we as a Black race are in solidarity against Trump, I don't want us to be fooled because I'm coming across lately too many Black people that are for Trump and they're blindly being led along. And I used to think we were in solidarity, and I knew there was always that few anomaly, but I'm coming across too many. And still, with what things are going on now, and you can't even, they're starting fights and everything, and families turning against families. There's too many people I'm coming across in the state of Maryland that are for Trump.
Darryl?
History. Nazi Germany, the rise of the Nazi Party. The character of Germany was a lot of quiet resistance. Ballot box, a feeling that the guardrails in place in Germany would take care of the problem. Well, the guardrails got removed. Germany did not have, when the Nazi Party rose, there were no protests. It was all quiet resistance, and they got steamrolled. So, for you believers in quiet resistance, good luck to you.
Thank you. Well, one thing, we're not selling all this. I just hope that our churches become as violently opposed as the rest of the community, maybe. Okay, we'll move on to the next article, which just talks about the fact that GLP is marvelous in many ways, but one of the things it does is that it produces this so-called Ozempic face, which is facial fat loss, sagging skin, and that they are trying ways to overcome this. But every treatment has its own side effects, and sooner or later we'll come across all of the side effects of all of these drugs, whether they're new or old or whatever, and there'll be side effects of the GLP-1 drugs. We just need to keep using it and find them out and then deal with them. Let's go to the next one as time is flying, as we have about 20 more minutes. RSV vaccine among older adults is something that we know is problematic and is cause of mortality in the very young and the very old. And so this article talks about the fact that many people may not be aware of the fact how devastatingly this virus is, and how many people are hospitalized and die as a consequence of it at both extremes of age. And so it's important to share this information. And it's so important that, again, we can't overestimate the importance of being vaccinated. An ounce of prevention, of course, is worth more than a pound of cure. And hopefully the new Secretary of Health will recognize it and uh, emphasize that. Dr. Perez?
Especially as the epidemic in measles is going. All of our research around vaccines, shut it down. Shut it down. Where we are going globally as it relates to HIV disease. We got the COVID vaccines because of the work on HIV. And now we're not providing health care globally through what is it? USAID. Shut down. We control the purse. Congress controls the purse. Congress controls the gas that goes into Air Force One. If they shut down, if they said they're not writing another check for that plane, boyfriend would have to stay in Washington.
Well, you know that the Republicans control the House and the Senate, and they listen to Trump.
The felon can be impeached.
One of the first things we need to do is to change the nature of who controls the House and the Senate of the United States.
Absolutely.
Okay, going on to the next article, please. And I applaud the fact that our group is so violently opposed to what's happening, and therefore we can play a major role in moving forward in the protestations that may make a difference. Now, this is an interesting thing to know that U.S. infant mortality dropped. What we need also to have is maternal mortality to drop as well. This is good news, and it's nice. Perhaps the vaccination changes are important, but we still need to do more about maternal mortality. It's wonderful about infant mortality, but we must do more about maternal mortality as well. Dr. Perez, your hand still up, or is it?
We absolutely do. And I know something, I wish a picture had been taken, but when my baby had her C-section, her obstetrician, her anesthesiologist, her head nurse, everybody, the entire team was Black. And she did well. We are 30 days out and she's still alive. And there are so many Black women, regardless of their education. My daughter's a physician because of Dr. Callender. But because so many, it doesn't matter your socioeconomic status. How many more times do Black women die? Getting pregnant for a Black woman is a risk factor.
Thank you for sharing. Let's go to the next article, please. This is an interesting article that talks about new warning sign of dementia. It's sleepiness. It's saying that as you age, you get more sleepy, but if you become more sleepy than usual, and you already have your 7 to 9 hours of sleep that is necessary, that this may be an early warning sign of dementia. Of course, having early signs of dementia are of no merit if we have no medication to treat it. But anyway, it's sharing anyway that this may be a new sign of dementia. I look for the day when we do have a drug that is effective against dementia, which especially against Alzheimer's dementia, which is the commonest dementia of them all. And these are the other signs that we have talked about for a while in terms of how dementia presents itself. And one of the other signs is that this sometimes people don't realize that suddenly your spouse is difficulty paying the bills and handling money. Sometimes this may be one of the early signs as well. And then all of these other signs, evidence that dementia may be approaching. And we've talked many times about the importance of getting help and not trying to manage a person with dementia all by yourself. Okay, let's go to the next article, please. It's interesting, we're seeing more and more impacts of shingles vaccine. Previously, we talked about its effect on the mental health. Now we're talking about its unexpected effect on heart health. And it's lowering the risk of heart disease up to 8 years. And those of you who are over 60 who have not had it yet, certainly shingles vaccine is something that is desirable just because of the fact that it prevents herpes zoster, but also that it has other positive effects that are very meritorious. It says without vaccination, 30% of people develop shingles in their lifetime. So that's a high percentage. Okay. 23% lower risk of heart disease, which is wonderful. Let's go to the next article, please. This is an interesting article that says weekend workout, regular exercise are equals at lowering GI disease risk. There's some people who can't exercise 5 days a week, but they want to exercise on weekends. And this article says that a weekend workout can decrease your likelihood of having lower GI disease risk. And so while there are 150 minutes a minimum is desirable, still a weekend workout can give you the same 150 minutes if you're willing to do it. And it pays off. That's the bottom line. So if you're somebody who can't do it Monday through Friday, but you can do it Friday, Saturday, and Sunday, then go ahead. That's what this article is saying. Call them the weekend warriors. Yeah. So the
I
impacts on
think
the
that's good to know. I think that's really good to know.
yeah, I do too. So do I. Okay, that's why we shared it. Okay. Can't do it one way, do it another. Okay. Uh sitting. We've already decided that it is the new smoking in terms of its effect upon your cardiovascular mortality and um, your contribution to obesity. But it also increases your risk for Alzheimer's. Uh, and so it's important then not to just sit around, but to be active. Sedentary behavior is one of the worst things you can do. Being active is one of the best things you can do. Uh, and they single out those who possess the APOE E4 alleles, the genetic risk for Alzheimer's, and those are people who need not to be sitting around as much. Betty Blaylock?
Yes, my husband and I are sitting here deciding who's more at risk, he lays in the bed most of the day, um, falling asleep, back and forth, watching television, while I'm sitting in a chair most of the day, working on the computer or doing some other exercises as far as, writing this or doing something else, using my mind. So I'm wondering which one is the worst. Him him
Well,
laying around in the bed or me sitting in the chair working.
well, this does not answer that question.
Thank you.
Neither would I try to answer that question. I would think that sitting or lying, you need as much exercise as possible, whether it be uh, uh, aerobic or non-aerobic exercise or weightlifting, or so there's so many different kinds of exercises you can do. And I think uh, that is probably the best answer. There are so many ways of exercising, whether it's pedal exercises or upper extremity, lower extremity weightlifting, so many different ways, some ways you can take advantage of overcoming the sedentary life that may be imposed upon you because of your own uh, disabilities. Uh, but there are ways to exercise and minimize the negative impact of sitting around and laying around. Any other comments to the question that Betty has posed?
Betty, you had a suggestion before, which is really hitting the nail on the head. Just doing housework, um, walking around. Even if you vacuum cleaner, you're using muscles back and forth. If you are lifting anything, and you clean the house for a whole hour, that is to me more than just going for a walk for a whole hour. Um, our parents and foreparents, when they washed clothes, they were lifting, hanging up clothes, taking down, bending. If you do gardening, all of that is a form of, it's not a form, it's exercise. When men had to dig ditches and plow and etc., and they worked from morning to night, and then they come home and relax while the woman is still working. That's why we living longer. So just the exercise, just doing around the house, period. Even though we have all these modern technology and everything, and where we don't have a broom, you got a vacuum cleaner, you're still doing physical exercise. You don't need to get out in the street and all that. If you went outside and hung up clothes, which I don't do anymore, will refuse to do because I don't have a clothesline. But all of that is exercise, and God put us down here to do that, to work, to keep busy. And if you had to do everything, you can sit around now because you got machines and modern day conveniences, even a washing machine to wash your dishes. But if you didn't have all these things, you would be in better physical shape. There were all these modern conveniences that help you sit around. Because when you cook, you don't have to raise your food, chop it, or wring the chicken's neck and run after it. Now you just go to the freezer, open the door, get that prepared chicken. So think about just what we can do. And you don't have to do all this other stuff, I don't believe.
Pearl Lipscomb is next.
Well, I was gonna give my sister some advice. Um, I do a lot of sitting around also, but recently I have been while I was on the computer, I've seen this thing called chair yoga. And I decided that I was going to try that. So I've started, I think it was last Friday, I started doing that. And it's when you sit in a chair and do a lot of yoga poses. So I don't know whether it's going to help me or not, but at least it's some form of exercise that I wasn't doing before. So I said I would offer that to Betty since she's sitting in her chair. She can try this chair yoga. I mean yoga, not yogurt, chair yoga. And it's online. There's a chart you can print out that tells you what moves to do and how to do it each day.
Thank you for sharing, Pearl. Darryl's next.
Okay, something is always better than nothing at all. So, but if something is good for you, you don't want to miss out on it. So you can do housework, you can do chair yoga, you can do this and that. But there is a benefit for getting the heart rate up, whether it's in long interval periods like for swimming or running. There's very definite benefits for that. Or the alternative is high intensity interval training, where there's short bursts of intense energy followed by brief recovery periods. But you got to do something more to keep your heart rate up. So, don't lose sight of that.
Thank you for sharing, John Tatum.
Yeah, one of my favorite modern conveniences is the elevator. I used to come to group session at Howard University Towers building, and it was on the fourth floor. And I used to come in there and start off from ground floor and walk all the way up. And I noticed that it was getting harder and harder each week to do that. So by the time I got to the fourth floor, I was all out of breath. So I had to stop and start using the elevator.
Thank you for sharing. Okay, I think it's 10:30. There's one article that I wanted to share was what not to say to the patient who has got terminal disease. John, can you find that article? I wanted to share that before we leave. What not to say to patients with serious illnesses. This is something that we doctors can do better about. And I thought this was interesting to share what this article says about what are the words never to say to patients with serious illness. And at the bottom of this article, it identifies about five items that, well, of course, listening before you're speaking is essential. But in addition to that, as you go down the article, you see that they identify five things doctors shouldn't say. Everything is going to be okay, is number one. It might be time to get your affairs in order to take that dream tape. Suggesting that's not a good idea. We definitely found cancer during your scan. We really can't tell you that it's cancer unless we get a biopsy. We can say it looks like it might be cancer. You have so many months to live. We doctors don't really know how long you have to live, so we should never say that. I wish you had done something differently. Well, it's too late for them to do something differently now, so it's not appropriate to say that. And I think that's important for us doctors to remember that we do the best we can with what we have, but we don't know it all, and so we shouldn't act like we do. And I just wanted to share that because it's so important for people who have terminal diseases and those who have diseases that are not so terminal. Okay, and I think we're at 10:30 already, and I think this was an incredible session today with so many people speaking out and